Welcome, everyone. I'm very happy to be here today with the chairmanship of the EULAR Research Committee. My name is Karina. I'm the project manager in the EULAR office. And today we would like to talk a little bit about the EULAR Research Center. So to start with, the chairs of the committee, Ronald von Vollenhoven and Dirk Elewaut. May I ask you, what is the purpose of the EULAR Research Center? Why has it been established?
Yeah, Karina, I think it's very important to actually go back a little bit in time why this was established. And this the ERC, or EULAR Research Committee, actually was established to create capacity building in RMD research in Europe. And it's quite different from the other organization that's working allied with the EULAR, being Voucher, which is a classical research funding agency body where you have career grants, specific focus grants, etc. Here we are actually focusing on creating infrastructure, but also capacity building to actually promote research, and which is quite different, but it's actually in a partnership. So don't see these things as standalone, but it's a hand in hand with Voucher, even though it's a separate organization. And we have established actually a number of initiatives, which you will hear during this session in more detail, and with all actually the same vision, and they are promoting capacity building, but this goes in epidemiology and public health, this goes also in clinical trials, and this goes also in basic and translational. And you will hear by the various subcommittee chairs how this is being organized and what is the anticipated impact on this on the long run.
And indeed, it is a signal that EULAR has the major commitment to improve research all throughout the EULAR countries by being the center point of research activities, in the sense that people will know that in order to collaborate, in order to create ties, to interact with one another, there is the EULAR Research Center, which can help, which can support, which can provide ideas and initiatives. And we're going to hear about a couple of things that are already happening, but there's lots more to come, because this is a relatively new initiative, and it's been very exciting to be part of this.
Exactly. We are now in year 2 since its establishment, or year 3 actually, established in 2020. So could you explain what were some of the concrete examples that have been established already?
Well, maybe I can take this onwards. So one of the things that we have been doing is a number of things. So consultation services, so that means actually providing expert advice to young researchers who are at the early stage of their career, and matching them with actually key opinion leaders on certain specified questions in relation to their research. So that's one element. So webinars have been organized, and then more concretely, I think we have also been starting things like the research voucher. What is a research voucher? Research voucher is actually a small seeding funding, but it's up to 5,000 euro. And the idea is actually to create seeding money for larger grants based on a small proof of concept type of study. And this is actually taking off quite well. There's quite a number of interested people, applications, and we have been receiving applications from all around Europe. So that is something that is, I think, very important for young researchers to permit. And then another element, I think, that is quite new, and which we have launched, and we had many applications, overwhelmingly number of applications, is the research method grants. Again, the idea is to create capacity building on new methodologies that promote RMD research. And so in this Congress, for example, we'll actually highlight some of these selections, actually based in a session, a dedicated session that we have, where some of these successful applications will be allowed actually to present their research. So this is, I think, a quite important type of number of achievements we have already done at the moment.
Yeah, and we had the publication voucher.
Yes.
So to support researchers who find it difficult because of the sometimes large fees for publishing very good work, but that is also something. And of course, we've also had the research committee, which has now been in operation for a couple of years, and which is consists of people who have really indicated their willingness and their enthusiasm to support this whole effort. And we are with about 20 from all the different countries, and we've had a number of very, very good brainstorming sessions, and some concrete initiatives have come out, and those have actually been taken also on by the subcommittees, and we'll hear more about those. And we expect that to be a breeding ground for more ideas, but also where others who think I have a great idea, you can always contact the people in the research committee and say, well, this is what we would really like the EULAR Research Center to be thinking about.
Anna Molto, you are the chair of the Subcommittee for Epidemiology and Public Health Research. What are some of the examples that you are working on at the moment?
Thank you, Karina. Well, within the EPI subcommittee, we are now focusing our efforts in two projects. The first project is the Impact RMD survey, which has the particularity to be exclusively patient data-driven survey. So we know that patients give a unique perspective on how they perceive the disease and how important the perception is when trying to evaluate the burden of the disease. So based on this, we decided to launch a longitudinal survey. That means that patients will be contacted over several months and we hope years. And patients will register themselves because several studies have shown that this is a very precise way to capture all kind of patients. So we have and ensure with these large cohorts a very good representativity of all patients with RMDs. We hope to have a very large sample that will allow us to run eventually some analysis with some rare diseases if we manage to properly, and that's a challenge upcoming, to disseminate this initiative so all kinds of patients across all the countries in Europe will participate. And the second project is a RheumaFacts project. RheumaFacts project aims to try to disentangle how much inequity in access to care actually contributes to the burden of the disease in our patients. The difference with the impact survey is for these RheumaFacts projects, what we will do is that we will gather data, some data that's already out there, available in WHO data sets, Global Bank, OECD, etc. So data on global wealth, demographics, etc. But the uniqueness of the project is that we are now contacting each one of the scientific national societies that belong to EULAR in order to make a collaborative effort so that they provide us at the national level specific indicators that only can be provided by them. And we will merge these data sets, and then we will have the go-to database for policymakers, for researchers, for scientists, for people with RMDs to know what are the causes leading to inequities and hopefully fill the gaps that we find in this project.
Thank you, Anna. And now, Andrew Cope, you are the chair of the Subcommittee for Clinical Research. What are some of the initiatives that you are working on at the moment?
So, Karina, we brainstormed quite a bit to try and come up with an initiative that would have significant impact across the research community and also benefit patients in the same way that Anna's talked about. And we came up with this concept of a trials network. So the acronym is ENTRI, which stands for the EULAR Network of Trial Centres. And our vision is to build a network spanning all 43 member states of the community and to invite trial active centres to apply for network sort of centre status with the EULAR stamp. So there'll be an accreditation process to try and identify units who are active and have the local infrastructure and experience to deliver on trials, but also to identify those centres where there is enthusiasm to contribute to such studies, where there are large populations of patients who are interested in participating. So the end point would be a large database of trial centres so that an investigator or someone in the pharmaceutical industry or their contract research organisation partners could subscribe to the database and put in some disease and identify very quickly which centres are active in that particular condition. If we think of scale, so 43 member states, and we can imagine how many trial active centres there are in different countries, there's the potential for hundreds of different centres. And one of the advantages I think that has is to conduct difficult-to-do trials with perhaps rare diseases or looking at individuals at risk of a particular condition, and to do trials and experiments that we really haven't been able to do before now. One of the things that we all do as a group is to try and make the centre joined up. And we're optimistic that some of the things that Anna and her projects will come up with will identify unmet needs so that we can really design and help support studies that will have a big impact. And then there will be the smaller sub-studies, experimental medicine studies, where we hope to link up with Rick and his advanced tissue analysis platforms to really maximize output from these sorts of smaller studies and really gain some traction around molecular pathways and potentially new targets for therapy.
Thank you, Andrew. And yes, Rick Loris, you are the chair of the third subcommittee of the research committee, and you're working on basic and translational research, and also you have a new initiative coming up. What is it about?
Exactly. So like Anna and Andy, our committee has started a project which we call the Advanced Tissue Analysis Initiative, acronym ATAI. The idea is that breakthrough science today, especially in the basic and translational field, is often associated with the use of new technologies. What we've seen over the last decade is really a strong evolution in those technologies, allowing us to look at single cell levels at so many things. The challenge is that these technologies require much more investment. They're more expensive, they need more machinery, and they're often limited to core facilities, and that makes the access for a large community somewhat more difficult. Now, we do have some experts within our field, and we also have very good connections. So the basic idea behind this initiative is to create a network that evolves into a wider community that is inclusive and allows researchers within the RMD field to get better access and knowledge about the technologies. For that, we will provide information in the form of webinars, but also protocols, data sets to train. We will provide consultation services, helping people with a very specific research question, how to find the best technology and how to apply it to solve that question. And we will ensure that over time, this gets really integrated and that we become that community that can be competitive. And that's very important in the terms of capacity making, as Dirk indicated, because what we want to do is remain competitive in the basic and translational field with other disciplines so that we can continue to attract some of the brightest minds to help us out.
So now we've heard about all of the new initiatives as well as the services and resources that the Research Center is offering. Could you explain again how does all of this fit within EULAR and its activities and its communities? You've already mentioned the work with patients and the input. Again, how do we work together within EULAR?
Well, if I may, one of the biggest challenges, in particular for basic and translational research, is effectively to include the patient's view. And I think that is something that is really at the center of all EULAR's activities. So within our committee, we all have patient research experts that have been trained to help us with layman communication, but also with providing the insight on how some things could appeal to the patient community so that we have their support, which is absolutely essential for Anna's project, but also to provide a way to connect with them so that they understand that all the work that we're doing in the different fields really will be beneficial over a long time. And with the support of their advocacy, I think we can create more means and also, again, be more attractive to a wider community to get more financial support.
Yeah. I would also say that taking the bigger picture, of course, that EULAR wants to be a force for the good, for the rheumatic and musculoskeletal diseases. What we want as an organization is to, in the end, help patients live better lives despite an RMD, or maybe even having the opportunity to prevent it from happening. We also want societies to have less burden from rheumatic and musculoskeletal diseases, which is a very big burden, so we have to think about that as well. And to get there, we need to support the educators, we need to ensure that there is advocacy, but we also have to support the research. because research is in the end Darwinian. Everybody is competing, and as RMD researchers, we're competing with researchers in many, many other medical fields that are all very worthy, and I wish them well, but we have to support RMD research. And these research is increasingly international and built on collaborations, cooperations, networks. And that's where EULAR, already being such a large organization, can play such an important role. So I think in that sense, we will all be, in the end, working towards that common goal of a better future for individuals with rheumatic and musculoskeletal diseases.
So maybe if I can add on to that, I think the spin-off of the ERC cannot be underestimated just in general. I think on both on let's say the patient level, but also into the education, building the research capacity for emerging countries. We have actually an emphasis on underserved country, that if they have an excellent application, this would be our priority, because we are building capacity across the entire Europe. And also from a strategy point of view, I think, and the RheumaFacts is, for example, an example, and all the other projects in fact as well, but it will actually also create capacity to make a better chance on European level for research funding to be successful. And this is a very competitive area of securing funding, and by creating this capacity, we actually probably will be able to be more successful in the long term to put RMD research at the center stage of EU funding.
So we've heard a lot about capacity building. I think there's another facet too which we're keen on, and that is competency building and teaching and training. And we have the EULAR school. And I think for a number of different areas, data analysis, some of the epistats that Anna's involved with the trials, getting young clinicians interested in doing experimental medicine and clinical trials is imperative. And I think we have to support that. There are a number of ways we can do that. So we're going to build a clinical trials toolkit, and I suspect that down the line with the school, we'll be able to set up webinars and training sessions. So it's not just about having that good clinical practice certificate. It's really understanding what trials are about, trial design, setup and delivery, recruitment and retention with the help of patients.
And if I may just add also on building competency, one of the positive side effects we hope to obtain with RheumaFacts is that since we will need national societies to learn, those societies who do already have the indicators that we need for them to provide us, we will use the opportunity of RheumaFacts to put these societies together, those who know how to do it and those who still yet don't know how to do it. And then we will have a mutualization of the knowledge on how and competencies on how to get these indicators that are crucial for our project to go at the EU level for advocacy, but also at the national level. And therefore we hope to have this positive side effect again.
So we've heard about all of the communities that we will work with and that will be involved. One member of our community, if I may say, of course, is also industry partners. Will they also be involved somehow in our initiatives?
So Karina, I think I see our relationship with industry very much as a partnership. So we want to collaborate, and we're certainly not seeking to compete, particularly in terms of the clinical trials network. And I think that relationship is going to have a number of different flavors, not least of which being getting their ideas about what a really good clinical trial center looks like. They've got really good experience around this, what the pitfalls are around study setup and everything else. And then the reciprocal is that we'll be able to find them literally at a glance which are the active centers working in different areas, rare diseases, more common diseases, so that they can execute their studies in a much more efficient way, get recruitment up quick, saves time, allow more people to participate in trials and to be exposed to new drugs that may have a big impact on their disease.
So all of these initiatives, all of these services are still at a very early stage. We are, as I said, year 3 now. If we move forward, fast forward 10 years, 2033, where is the research center? How do you see the research center
We'll be
10
retired,
years?
won't we?
I will not be.
Oh yeah, well okay. I speak for myself there. Yeah, okay.
No, we hope that we will have created that capacity in a way that is clearly recognized, that we will have used both for clinical trial settings, for the epidemiology as well as for basic and translational research, the intrinsic resources that we have. And I think one of the common themes that you have heard is we need the right material, we need the right set of data, and we need a lot of data. And with the technologies available, I think we should make some major leaps in what we are doing. Improve personalized medicine, the biggest challenge for most of patients with chronic arthritis today. Better treatment for systemic diseases where they're largely lacking. And of course also a few of the societal challenges in both chronic joint disease such as osteoarthritis and chronic bone disease such as osteoporosis.
Yeah, I don't even think it has to take 10 years. I think 5 years from now, it's already going to be that the EULAR Research Center is the go-to place for research. If you're an R&D researcher in Europe, you want to know about what's going on, you want to know who you can work with, what is available. If you want to set up new projects, I think that is where you're going to go to. We are already doing a lot and we're going to be doing more, but I also find that we can include our colleagues so well in the research community and also those other stakeholders we've talked about. So yeah, I definitely think we're going to be there quite soon.
And if I may add on, I think I would envision that it was also, having the ERC will also inspire the next generation to move into an academic career in rheumatology, which is I think, you know, Andy mentioned that we would retire by then, but I think we need to think about the next generation. And the spin-off of this might be that RMD research is an attractive field to be active in. And so we think this will be inspirational for young and talented people, which there are many of us, but actually take the risk to jump into an academic career.
Yeah.
Okay, so thank you very much again for joining us in today's session. It was great to talk to you and to listen to these new initiatives. And I hope we will sit again together to review in 5 or 10 years. Thank you very much.